Hello, this is Dr. Grande. Today's question is, what are existential obsessions? So this is an interesting question, and when we think about the term existential obsessions, we're talking about a symptom we sometimes see in obsessive compulsive disorder. Existential obsessions are also referred to sometimes as philosophical obsessions. So in obsessive compulsive disorder, OCD, we see obsessions and or compulsions. So an obsession is a thought that is disturbing to an individual who has OCD. Now, with the case of existential obsessions, the thoughts all center around existential or philosophical topics. Now, somebody can have existential obsessions and other types of obsessions and compulsions. So it's not that somebody with OCD can only have one type of obsession. Now, with existential obsessions, there's a preoccupation with existential topics like the meaning of life, the nature of God, or does God exist, the nature of the universe, how did the universe get started, the nature of reality and consciousness, what happens when somebody dies, do they go to heaven, hell, purgatory, do they cease to exist? Sometimes with existential obsessions we also see an interest in science, like physics, biology, chemistry, usually in an effort to explain how people got here. We also see an interest in morality. Is there an objective nature to morality? Does morality have meaning? Should people be moral? All these different questions. We can see various reactions to these existential obsessions, and some of these reactions, of course, we would consider compulsions. Some would be that other obsessions tend to appear that are in the same theme, the existential theme. So we can see individuals with these obsessions read about existential topics, do research on it, ponder existential topics, so they could think about these topics quite a bit for hours every day perhaps. Look for reassurance, so if they select a particular point of view, if they believe they've solved an existential or philosophical issue, they'll look for reassurance that they're correct from people that they believe might know those answers. And also, with these obsessions, we see an attempt to solve the question, to answer the existential question. When looking at OCD, we could think of intrusive thoughts as being different than ruminations. Now, with an intrusive thought, these are usually disturbing to somebody with OCD. They try to avoid these thoughts. These thoughts oftentimes have a sexual, violent, relational, or religious nature to them. And the individual with OCD who has these thoughts considers them undesirable. They really want to get rid of them. A rumination has a different feel about it. Typically, ruminations are not resisted. The individual with OCD who has ruminations does not consider the ruminations to be offensive or even troubling. And really, ruminations are a series of thoughts that go on for days, months, or even years. Again, with the existential obsessions or ruminations, we could think of these as going on for a long time and taking up to a few hours a day. That's much more consistent with a rumination than an intrusive thought. One of the difficult elements of existential obsessions or ruminations is differentiation. It's not unusual for people to contemplate existential and philosophical questions, like the nature of God or how did the universe start. How do we know when these type of thoughts are something that we would expect and when there's something that would be associated with obsessive compulsive disorder? For individuals without obsessive compulsive disorder, one of the key features is they're able to switch gears. They're able to think about these really deep existential and philosophical questions and then move on and think about something else. And typically they wouldn't spend a lot of time with these types of thoughts. Also, they would likely come to some sort of resolution. Even though they can't necessarily solve the problem, they can't figure it out, they can accept what they don't know, and they can have a belief about these existential and philosophical topics. With obsessive compulsive disorder, we usually see there's no resolution, or the resolution is not satisfying to the individual. Also, we see depression and anxiety associated with these existential ruminations. So if an individual only has existential ruminations, that becomes the most difficult situation to differentiate from OCD and without OCD. If somebody has these ruminations and other symptoms of obsessive compulsive disorder, it becomes easier to differentiate. And usually with existential ruminations, existential obsessions, we do see other types of obsessions and compulsions. It's unusual to only see this type of obsession without any other symptoms. However, as I mentioned, when that does happen, it's difficult to differentiate. And I also think there's a bit of a gray area here. So one of the concepts we think of as associated with OCD and these obsessions is that there's no resolution. Yet we see examples where individuals do ruminate on these topics for a long time. It does lead to anxiety or depression. It is time consuming. But at some point they do come to some sort of resolution and they no longer ruminate about it. So really that seems to be in between not having OCD and having OCD. There is a gray area there. So another question I get in terms of existential obsessions, ruminations, is can they be treated like any other obsession? And the answer is yes. There are treatments available for OCD, and those treatments can be tailored, modified to work with existential obsessions, ruminations as well. Really, even though these obsessions have this unusual characteristic about them, meaning their philosophical nature, and we don't typically expect to see that, they are still obsessions. They still usually respond the same way other obsessions would to treatment. I hope you found this description of existential obsessions to be interesting. Thanks for watching.